Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about how to study for the inpatient medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, this video is going to talk about how to study for the inpatient side of medical coding. This is not at all referring to outpatient or professional fee coding, okay? That's gonna be on a completely separate video. But for this video, there's a lot of people that tell me, well, Blue, ICD-10 PCS was only covered in a small portion of my program, and I really want to sit for the CCA or the CCS. Some people have said that they want to sit for the CIC, and the CIC is the inpatient certification through the American Academy of Professional Coders. The CCS and the CCA are both credentials with the American Health Information Management Association. Okay, so two different organizations, but all these three exams cover inpatient medical coding. Now, this inpatient medical coding involves, of course, the ICD-10 CM, and that is the diagnosis coding, but it also involves the ICD-10 PCS, right? So that's the inpatient procedure coding, all right? And when you have those, you have to build those codes. ICD-10 PCS is completely different from CPT, which CPT codes are already made up or they're already together. With ICD-10 PCS, you have to put those together, and every patient is different. Every surgery is going to be different. So it has a lot of different combinations that you can get from that. But the thing that I want to share today is some of the ways to study for the inpatient side. A lot of these medical coding programs are covering the outpatient side because in the beginning it is easier for people to understand stuff that's already put together. ICD-10 PCS is a completely different ball game. So just so you guys know that right out of the way. So I want to show you some books. I always leave these links in the description box for the workbooks that I recommend. And I'm going to say this again, guys. Every single book that I recommend, from the anatomy books, the medical terminology books, and all the other helpful links, they're always going to be in the description box below. Always. And my contact information, again, in the description box below. So take the time to check that out. It's very helpful. There's a lot of really good information. Okay, guys? And I give this to you guys for free. I don't ask for anything in return other than you watch the videos. So anyway, this is the book that I recommend for workbook, okay? This is the ICD-10 CM and ICD-10 PCS Coding Handbook with the Answers. And this is by the American Hospital Association, or it comes from them. The author is right here. Now, this is a 2019 book. You can still use this for study. However, I will say, because this book is a little cheaper, all right, because it's a few years old now, you can get the 2020 or the 2021 book, whichever one that you find is a good price, all right? It's going to have the same questions as the current year 2023 book, all right? And they may be in a different order, and some of the codes may have updated, but for the most part, the explanations are going to be the same. So if you want to save yourself a few bucks, that's why I always leave that link in the description box below. Those are the Amazon affiliate links. You certainly do not have to click on those links, but the title is there, so that way you guys know. This is the book. This is a workbook. Now, when it comes to studying for any of these exams, the CCA, CCS, or the CIC, I do not recommend getting the AHIMA prep book for the CCS or the CCA, because those questions are not going to be on the exam. Now, a lot of people will say, well, Blue, that's just common sense. Well, trust me, I've had some very upset people write to me and say, well, Blue, I studied that book forward and backwards and none of those questions were on the exam. Guys, they're not supposed to be on the exam. If they were, then everybody could pass, right? So that's the thing that you got to keep in mind about these books. They're only meant to prepare you. That's why I say don't even worry about those books. Get this book to study with. This is a very comprehensive book. It goes over all of the chapters and it breaks it down very well. It covers diagnosis coding and the ICD-10 PCS coding. So my recommendation, if you are studying, is to completely work through this whole book. Completely work through the whole thing. And take the chapters and break them down however many weeks you want to give yourself to study. If you are self-studying, I have that independent study list out, the syllabus, again, in the description box below, guys. And on that list, I do say take between 2 to 3 months just to learn PCS, right? 2 to 3 months. I mean, 2 is kind of going fast, but only because so many people pressured me. Well, Blue, I don't want to spend that much time. Guys, this is up to you. If I had my way, I would tell y'all to spend 3 to 4 months so that way y'all can really be prepared, all right? Because it's a lot to learn. With ICD-10 PCS coding, you're having to piece together the entire code, right? And this is 7 digits, guys, and that's 7 ways that you can mess this code up, okay? Because even being off by 1 number or letter is going to mess up the whole thing, right? So you want to make sure that you understand the approaches, you understand the ways in which they can get to that particular area in the body, and you have to understand your anatomy, guys. Anatomy in medical coding is critical, most importantly in the inpatient setting, guys, because when you're putting together these procedures, you really need to understand, because they're not always going to use the same language that's in the book. And in the back of these books, there's always appendixes. Now, the book that I recommend for PCS is always going to come from Optum 360 Coding, okay? I can't see the camera, so hopefully I'm still in the shot. But for ICD-10 PCS, yes, this is the 2021 book. I just haven't gotten the 2023 books because I'm trying to be good and stay away from the Optum site. Optum is who I will always recommend for their books for ICD-10 CM and ICD-10 PCS. Because in the back of this book, in Appendix M, like in Mary, there is a whole list of procedures that you can look up. This is the other thing that I recommend, not only working through this purple book here, but also working through that entire Appendix M. Now, in Appendix N, like in Nancy, they have all of the answers and some of the rationale to those questions. So that's the thing, guys. If you're working through this book and you're working through this book, it's going to get you faster when you're trying to get through. Because remember, these are timed exams and you really have to know. And as somebody who took the CCS in 2021, I took and passed the CCS in 2021. And when I did, it was that I had gone through that whole section. And I had gone through this other book here as well. Because I was trying to get more practice with PCS. I do not have any hands-on work experience on the inpatient side. So everything I learned, I had to learn from these books. And so that's why I say it's very important to get yourself that practice and that continual practice. Because you may think, well, no, I want to read notes. If you can't look up the codes, you certainly are not going to be able to get through notes. So that's why I say go through the entire Appendix M and code out everything. That's going to make you a faster coder. You're going to understand like keywords and what to look for so that you know the approaches, because that's very important. You have to know those approaches, all right? So work through those, and it's in the back. It's included with this book. Now you can still get the 2022 editions on sale from Optum 360 Coding, and I will leave the link for Optum in the description box below. You can still get them on sale. I think they're like 20 something bucks right now. Don't quote me, but they're like 20 something bucks with no, for the ICD-10 PCS book with no free shipping, with free shipping. So you can get that and study with that. And then if you want to sit and take the CCS or the CCA, AHIMA will go into the 2023 editions May 1st. So if you study and you really buckle down and maybe you just needed a little bit of a jump on how to code for inpatient, then if you think that you can sit for it by the end of April, you can still use the 2022 books. But May 1st, they're going to switch over to 2023. So you can still get your book for 2023 later on in the year if you want to, and then sit for your exam. Because you may be able to find it on sale again, because they're always having sales. So with that, you can do that. So that's just what I would recommend anyway. So get that, because again, it's going to help you to get that practice in. And I want to point out something else too. My book is clean. This was the very book that I used when I took my exam. Notice I do not have it tabbed. It is unnecessary to tab your books. And I will say this also, if you look at the AHIMA website and you look at the candidate guide for these exams, it will say handmade tabs are not allowed in the books. Excessive writing and highlighting, excessive writing is not allowed in the books because these books are going to get inspected and they're going to get looked at, they're going to get shaken out and everything. And if you have too much writing in your book, then they're going to say, okay, well, it looks like you're trying to cheat. So that's the thing, guys. I would not want to risk the almost $400 that you got to spend for these exams. I wouldn't do it. So keep your books clean. And that's what I'm saying, guys. I did not have any writing in my books. I did not have any writing in my books when I very first took my exams either. When I took my CPC-A way back in 2008. I didn't have any writing in my books because they were very, very strict back then. Now, they have loosened up a little bit when it comes to the tabbing because they say if the tabs came with the original book, then you can use them. But this book does not come with original tabs. So again, you don't need them. If you are practicing with this workbook, if you're practicing with the Appendix M in the back, you're not going to need them because you're going to get so proficient with the book that the tabs are just going to get in your way. They will tear your book, all right? So that's just my advice anyway, guys. Please don't argue with me when I say these things. I say these things because I want y'all to be successful. I've seen people who have their book all tabbed up and they think it helps them, and actually it does not, because you're having to sit there and go through and look at those tabs each and every single time rather than knowing your way through the book and saying, okay, I know exactly where to look for this and exactly where to look for that, okay? So that's just my advice anyway, guys. I want y'all to be set up for success, all right? Now, this other book, of course, is the ICD-10 CM book. Now, all the coding rules are in here, and in section 2, it does cover inpatient coding rules, all right? Again, inpatient being completely different from prophy, all right? So this inpatient rules, again, is covered in section 2. It has everything in here, all right? And at the beginning of every single chapter in the Optum 360 ICD-10 CM book, they have examples of how to apply these codes in every single section. And it gives you the rationale as well. So I think this is really great, especially if you are learning on your own, or maybe you're learning in a fast-paced medical coding program and the teacher's not really teaching you. This book has a great way of breaking it down so that you can understand and you can practice. Looking up the codes and spending time learning the books is really big, guys, especially for the CCS. If you're sitting for the CCS exam, 51.9% of that exam is your medical coding knowledge. And that means you have to know how to get through these books because, again, these exams are timed. So if you want to have that quickness, it's not about doing those exam tricks that people try to put out there, guys. There's nothing that's going to save you more than your knowledge. Nothing will save you more than your knowledge. Knowledge and practice. And it's not going to come to you overnight. It's not going to come to you in 2 or 3 months. But it will come to you with time and a lot of consistent practice. So take the time to go through those. On my Patreon channel, I do a lot of exercises. Patreon, if you don't know, is a lot like YouTube, except that, you know, you're paying to support the creator, which would be me. And on my Patreon channel, it's pledges per month, right? So there's no commercials or anything. You don't have to sit through commercials or any of that. But you are, you know, you do have access to all the content that I post. Now, I do post quizzes for ICD-10 CM, ICD-10 PCS, and for CPT. I do host a once a month live Zoom meeting. It's a study hall. This month, I'm going to be going over the evaluation and management tool. The table of risk, actually, is what I'm going to be going over. So if you're interested in that, if you would wish to join my Patreon channel, you can subscribe for a month and then unsubscribe is totally fine. I do not expect people to constantly be on there because it is a great resource for study. And again, you can meet with all of us once a month I do my once a month. My next one is going to be on the 21st of January. Yes, 21st of January at 3 p.m. Central Standard Time. We're all there together live and talking. And of course you do get access to videos about me, stuff that I don't share here on YouTube. But I shared on my Patreon channel just today, and it's New Year's Day. I shared on my Patreon channel all the links, the specific links for the guidelines for ICD-10 PCS, and for just a lot of other helpful links that I have on there. The Medicare Learning Network obviously is on there. That direct link is there. So that way my patrons have direct access to all those specific links. So if you're interested in that, all that information is there. So again, that's something I can share with all of you guys, and those funds go directly to my education. So that being said, my biggest bit of advice when you are studying, and if you are using the independent study list to supplement your studies, maybe they didn't cover ICD-10 PCS very much in your program, you can still learn it on your own. It is the same way that you learned the diagnosis coding. You're looking it up in the index, and then of course you're going over the tabular section. It's the same way. Okay, guys, the structure of these books is going to be set up the same way. It's going to go at the same cadence. Always look at the index first and then go to the tabular. Get familiar with your books, guys. That is the biggest bit of advice that I have, is getting familiar with those books. Because believe it or not, people will not want to look through their books. Somebody the other day had asked me, is it better if I just use the internet to look up the codes rather than to go through the book, and they're still studying? And I said, no, you need to look at the books, because that's the only way you're going to get proficient. Sometimes the stuff that's on the internet is not always correct, right? And there's going to be stuff on there that's going to be old on the internet, and that's just another thing that you got to know. Now, yes, I do recommend to study with these older books, but when you're looking up these codes and maybe your code doesn't match what's in these workbooks, well, you'll know if their code that's in the workbook is actually not in your book. You're going to know that particular code got updated, or maybe it got deleted. So it's going to be a real easy thing for you to figure out, okay, well, this code got updated. And again, you can always get the most current book if you want to, but I always try to think of the most frugal way of getting education. There's a lot of people out there that think that they need to spend tons of money. I've heard from people who said that they got a student loan for $20,000 just to study medical coding, when you could have just, done your research and spent a few $100s and gotten the same education, and probably better, because $20,000 is a lot. And to me, I don't want to start a new career in debt, in student loan debt. So I've always been very trying to do my research and trying to figure out how to do all these things. That's why I always encourage you guys, look on YouTube. YouTube has a ton of anatomy channels, medical terminology channels to help you to understand those things. Again, on my Patreon channel, and the lowest level right now is $10 per month. And so I also do the word searches, and I do word finds and things like that to help with medical terminology, because that was how I learned. My mom started me on those crossword puzzles and word finds and stuff like that. And so that helped me, because then it's just oh, now I get it. And so making it a game always helps. Hanging up posters where you can see things visually, like we did when we were kids, right? Remember when we were all in school and the teacher had the border up over the room with the numbers and the letters. It's the same thing you have to do when you're in school to learn medical coding. You've got to hang up your anatomy posters. Again, all of those links are in the description box below, the ones that I recommend. But you can literally get anything and just hang them up. You can even print some from the internet, right? You do a simple Google search, right? And you'll be able to find those. And they're not discovering anything new in the body. The body is still pretty much the same. So you can pick anything that you like and still get a great result as long as you are consistently studying, all right? And the key to adult education is repetition. Repeating and repeating and repeating. Rinse and repeat. Taking the time to work through these workbooks. When I was studying in 2021 for my CCS, and for my CCSP. When I was studying for those in 2021, I would be doing live shows. I did a lot of live shows in 2021, and it would take time because my live shows are not quick 20-minute, 30-minute shows. They were going for an hour, 2 hours, sometimes close to 3 hours, because, you know, you get to talking and everybody just has a good time, and you know, it was taking a lot of time. And then when I would get done with the show, I would go take a shower, and then I would go and I would work on my the section in in that book, or M rather, and I would work through those because it was important to me that I pass the CCS exam. And the CCS exam will put up a fight, guys. It's not an easy exam at all. It is a mastery for a reason. This is the medical coding credential of all medical coding credentials. It is the gold standard of medical coding because it says that you have mastered inpatient and outpatient. But in order to get it, you have to really study hard. Now, there's some people who are really good with taking exams, and that's just how they're able to pass. But for those that, you know, and it's a very small percentage of the population that can do that. But for the rest of us, we have to study very hard. And if this is something that you want, you know, that CCS is going to open a lot of doors for you. Same thing if you're brand new and you're going for that CCA. I had the CCA for 13 years, guys, and I did a lot with the CCA. So don't ever let anybody tell you you can't do much with it, because yes, you can. And employers do look for it, because, you know, these job listings are going to be listed differently. Okay, not everybody's listed as a medical coder. There's some that are going to be listed as health information technicians, or, you know, medical records technicians. Is going to be listed under different names. So make sure that you know that when you're studying for these exams, okay? But you want to, if you want to sit for a credential that's going to give you the most opportunity rolled into one package, the CCA or the CCS. And again, there's a lot of employers that are looking for that CCS, but it takes hard work, and you got to hit the books in order to do it. This is the one and only book I will recommend. This is not an exam prep book, but this is going to give you all the practice that you need. This is what I used. And so this, again, is what I'm saying. If you work through that and you work through the ICD-10 PCS appendix section, you're going to be good to go, because you're going to understand how to do the coding for that side. Now, I will do a similar video to this for the outpatient coding, but later on. So, but for the moment, I will go ahead and wrap this one up. But thank you guys so much for joining me. Again, if you are studying, make sure that you get yourself on a schedule, go through those books. And please do not, one other thing, please do not use a CPT book with this book. This book is not going to give you any answers for CPT. The codes are going to look completely different. This book is just designed for the ICD-10-CM and ICD-10-PCS book. Now, I have to say this because there's been a few folks that have written in and say that none of their answers were the same. And that's why I'm saying this, guys, okay? So only use the ICD-10-CM or ICD-10-PCS with this book, okay? So if you are not studying for the inpatient side, but you do want to get practice with diagnosis coding, you can just go to the ICD-10-CM part, skip the ICD-10-PCS part, and use this, because it does give really great explanations. There's a lot of great practice in the back. There's an appendix with a bunch of practices in the back, and it covers all settings. It even covers the ER as well. So that's just something else you got to know about this fantastic book that I love so much. But yes, this is the one I would recommend, okay? You don't need all these fancy boot camps. You don't need all this other stuff. You just need a lot of diligence and hard work, because spending a lot of money does not equate to passing the exam, guys. It doesn't. If you need a tutor, that's something different. But just trying to pay out all this money because you think that that's what you need to do, guys, all you have to do is just take the time to practice with the books. That's it. You know? Anyway, I'm just saying. So I'm going to wrap this one up. Thanks again, you guys, for joining me. If this video helped you, I hope that you will like, subscribe, and share. And I will see y'all next time. Bye.